Prior to implementing an EHR, we had people carting suitcases between our offices with heavy charts. We've had patients 20, 25 years, so each one of those charts is very thick. We have a filing system with that, but in any chart that's now 2 and 3 charts thick, it takes a little while to find the pieces of information that you're looking for.
It was just a lot of work managing those charts and making sure that everything was filed correctly.
With how medicine is changing and the volume of flow and the requirements we have to document much more thoroughly and communicate much more thoroughly with not just within ourselves but with outside providers as well, that it made a lot of sense to look now for a system.
We wanted to be able to be more efficient with our medical records. We wanted things to be more legible. We wanted to be able to just be able to take care of the patient better by having that information so readily accessible to us.
We looked at several systems, but really Sage stood out as really encompassing what we needed for the OB aspect of our practice at the time.
We decided to go with Sage Intergy Suite because we've had very good success with Sage. We've been a long-time client of Sage, and I've found them to be very reliable. I've found the system to be very user-friendly, and quite honestly, it was an easy decision.
I think probably the main component was because we're both an obstetrician and gynecology practice, it was the OB package that was available with it at the time.
One of the most important features for me was for the 2 applications to be able to integrate. I didn't want to have 2 separate systems. I wanted to share information between the 2. If you entered it once in one, I wanted it to be in the other.
Our business, since we've installed Sage and Intergy EHR, has been phenomenal. We have a streamlined system. We're a very busy 5-person OB/GYN group, and it's allowed us to function much more efficiently. We communicate with each other much more efficiently. We communicate with the hospital, with our insurance carriers, as well as other physicians.
The implementation of the system was very organized, and I really need to commend Sage and their staff on that. There was a project team that was put in place, and I think one of the things I liked best was we had a project manager, and that project manager absolutely kept us going and on target.
We've had great support in implementing and the processes. The updates have always been positive.
We knew that there was a whole team of people behind us, so much different than if you were to buy something off a shelf and have to bring it in and try to make that work in your practice.
Since we have made the transition over to an EHR with Sage Intergy, we have a streamlined, financially sound practice that we feel can move forward with technology as it's changing today.
Claims are more accurate because, number one, you've checked eligibility before the patients ever come in. When you actually run the insurance, you're able to fix any errors before you ever transmit. So the claims are going out very clean, and the turnaround time has dropped to 15 to 30 days.
In our field of obstetrics, our malpractice rate in Illinois is very high. We have incentives to lower our rates based on documentation in our medical records, and we get percent back, so many percent back for having an EHR, for having a specific OB flow sheet. We brought down our percent of our malpractice rate 9% when we went to an EHR.
What the physicians like most is being able to work constantly throughout the day and not have work pile up for the end of the day.
On a given day prior to having an EHR, we would have one physician on call who would be taking calls into the office for all 5 of us. and a nurse assigned there who would take all of those calls and then pull charts throughout the day. And you may, by 4 o'clock time slot, have another 2 hours of charts sitting on your desk to attend to as everybody else is leaving. Now the system is such that our nurses individually can send us information with questions about patients, a lab result, somebody with a problem, do they need to come in today or tomorrow? And we're attending to that as we're seeing patients. It's just a smooth flow. There's always tasks that are lighting up on our computer screen, and I might have finished all the tasks and see a couple of patients. There's 3 new tasks that are done. It's not 25 or 30 at the end of the day. It's wonderful.
If you go into the patient's chart and you are looking for a mammogram, you are looking for their last gynae or their last document, you know exactly where it's at because it's there. If you pull out a chart, you're thumbing through all the lab results looking for what lab you want. This way you've got it. You know the date it was done, around the time, it's highlighted. I mean, it's a much more efficient way of finding your results.
Within our practice, there's 5 physicians, and we each have our strengths and weaknesses. And one of my partners is the kind of our guru of setting up templates, and she, with quick few minutes, can put together a template that works very, very well for us. Somebody will make a comment, I've had 3 patients today with psychiatric complaints that are kind of affecting issues, but I had to go searching for the information on how to apply that to the templates we have in gynae. A few minutes later, she's got a template up and running, and we've suddenly able to incorporate that in pretty easily. In terms of what we see every day, we deal with pap smears every day, and how we manage them with colposcopies and follow-up paps and possibly leaps. She has made a template for that moves from one section to another, but it's all on one template, so you don't have to even think twice, where do I need to go to get the information for this? It's on one template, and you click into the aspects you need, and you've got part of your chart done.
The OB record that we have, you can just look at the flow sheet for the OB record. You've got all the weights, you've got everything lined up right there in front of you. It's great. Their blood pressures, everything you want. If they're say for some reason, for a patient that's Rh negative, which is important for us to know when they're pregnant, that comes up in red at the top of the OB chart, so you're watching out for that.
The ability of the Sage Intergy EHR system, and specifically in the OB chart, is that it affords much more safety in that it doesn't rely just on somebody remembering. There's another reminder that somebody is between the 24 and 28 weeks, we should be getting the glucose tolerance test done. Has it been done yet? If
a patient comes in and they're coming in because they want to follow up on their ultrasound is already in the chart. So in the computer, there's no looking for it.
Since we've gone to an electronic health record system, and one that works as smoothly as Sage has for us, that we have improved our patient care. We have improved that in the aspect of timely response to inquiries, to being able to easily find appointment slots, to bring them back into the schedule, to get the follow-up scheduled, the reminders that go into the computer when somebody has had a mammogram that needs a repeat in 6 months.
Well, just the fact that you can, 1, understand everything that's written. 2, you know exactly where every piece of information is in that chart, and it's right there. All you have to do is pull up, you have to tap on it, and it's right there at your fingertips. It's just a much nicer way of having a chart put together.
Everybody has all the information at their fingertips all the time.
It's hard to go back to think that you actually worked in a chart and you had to find charts, and it's all on the computer, and it works great, and I learned it, so anybody can learn it.